One of the main reasons that there's a difference between rural and urban populations is we have a higher percentage of both elderly and patients who are more vulnerable with multiple medical problems or conditions. Both of those groups are more likely to become severely ill or do poorly should they contract the virus, which makes it even more important that we follow good social distancing practices here to protect those vulnerable populations that we have living in rural areas. A second issue is rural hospitals having smaller capacity to deal with any kind of a surge. If we have even just a few patients who are critically ill present at the same time to a small hospital, it may overwhelm the capacity for things like ventilators, for our personal protective equipment supplies, as well as for healthcare providers. So we need to be doubly sure that people are following those precautions. We also have a harder time for people to get to care because of the distance. So many people actually live a good distance from a hospital or a healthcare setting where they can be evaluated. And so we need to be sure that patients are prepared for the distances involved. And then the fourth issue would be the difficulty in getting information out. Many rural areas still lack adequate or consistent broadband services and may not have even internet at all in some locations. So it makes it more challenging for doctors and hospital systems and the public health departments to get adequate information out that is correct and up to date to those populations. All of this means that we need to be socially distancing and protecting our most vulnerable population by making sure that we're not spreading the virus throughout our rural communities.